Hello, this is Dr. Tom again, and the last time that I had spoken with you, I talked about the administration of the HCG. I would like to talk a little bit about why we started doing the HCG in a lot more people than we did from the beginning. Initially, we did the HCG diet mainly for family members who asked me to do it for them, and we saw a huge amount of success. And the thing that was astonishing about it is that we knew these people. We knew their bad habits. We knew what they were like, their personalities, how much they liked to eat, what types of food that they ate. And when you saw this incredible amount of fat loss in people knowing more of their personal life, it was, my gosh, if they can lose weight, anybody can on this diet. But one of the very first patients that we ever had was actually a fertility patient that was being seen by our acupuncturist. This was a 36, 37-year-old woman who basically was coming in because she wasn't able to get pregnant. She wasn't married. She felt that she was getting older and that she wanted to have a baby before she reached 40 and felt like that when she would be able to not have babies anymore. Well, she having problems getting pregnant. Well, the acupuncturist felt that fat loss or some weight loss would be very beneficial, and as being that she also had what's called PCOS, which can be very much related to insulin dysregulation and large amounts of fat. Well, she did the diet with us, and she did very well. She ended up doing 3 rounds of phase 2 and lost over 100 pounds in about an 8-month period of time. And we saw her afterwards, and she actually did a testimonial for us, but we didn't see her for quite a while. And she came up again as a topic in the office when one day there was a magazine, a woman's magazine, that was delivered, and she was on the front cover. And we noticed her profession of who she was, and then I looked at the name, and this was the patient, but you wouldn't have recognized this woman at all. She was dressed in a beautiful evening gown. She had blonde hair, which she wasn't blonde before, and she looked fantastic. Well, we soon, maybe a few months after that, we contacted her to see how she was doing, and she since then said that she had a fiance and was planning on getting married, and they were going to work on having a family. And the next time that we heard from her, she had just delivered a baby. She was married, she had her own baby, and was practically in tears because of how much her life had changed. One of the reasons that we kept on doing this diet mainly within our practice was because of these incredible changes that we saw in our patients. The vast majority of people who would walk through the door who needed some type of intervention for their health needed fat loss. And of all the things that we had tried in our practice, this worked the best. Thanks.